Afternoon, oral health stakeholders. Thank you to all of you all that have joined us for this breakout session entitled Assessing Oral Health Inequities Among Special Populations. So again, good afternoon. I'm Terrence Robinson. I will serve as the moderator for this session. This session will include 3 separate presentations. All attendees have been muted. Without further ado, we will begin today's presentation entitled Assessing Oral Health Inequities Among Special Populations.
Thank you, Terrence. We would like to take this opportunity to thank Well Ahead and the Louisiana Oral Health Coalition for this opportunity. I am Dana Gray, the Project Director and Principal Investigator for the South Central AIDS Education and Training Center at LSU Health in New Orleans. I have presenting with me today is Dr. Nichols. He is not only our regional dental provider, our regional dental director, but he is also the Director of Dental Services at Avenue 360 Health and Wellness.
Hello, everybody.
Just so you are aware, neither presenter has any financial disclosures. Next screen. You can go to the next screen. So by the end of this presentation, we're going to give you an overview of our program, the AIDS Education and Training Center, as well as our training efforts for our region, which is Louisiana. Next screen. So the AIDS Education and Training Center program has been a cornerstone of the HRSA, which is Health Resources and Services Administration HIV/AIDS program, for over 30 years. It supports a nationwide network of 8 regional AETCs, which are federally funded through the Ryan White HIV/AIDS Treatment Modernization Act to increase the number of healthcare professionals to counsel, diagnose, treat, and medically manage persons at risk or living with HIV. Our region is the purple region, where the University of New Mexico serves as the South Central Region's grant administrator. Our region includes Arkansas, Louisiana, New Mexico, Oklahoma, and Texas. And in Louisiana, there are 2 local partner sites in, as I mentioned, Louisiana State University Health Sciences Center, as well as Access Health Louisiana. Next screen. So our training efforts fall in line with the National HIV/AIDS Strategy. And as you can see, it is to reduce new HIV infections, increase access to care, and improve health outcomes for persons living with HIV, reduce HIV-related disparities in health inequalities, as well as achieve a more coordinated state response. And we do this by making HIV testing routine for all persons between 13 and 65 years of age to ensure they have at least 1 test as recommended by the CDC, identify barriers to establishing HIV care and develop plans to address those barriers, ensure providers are able to specifically meet the need and provide culturally sensitive care, and working together for a common cause, reducing the impact of HIV in our state and our communities. With these steps in mind, we can help persons, healthcare professionals can help persons with HIV or at risk to move along the HIV care continuum. If everyone is tested, it can help remove the appearance of stigma. So diagnose everyone. If positive, then we link the patient to care. But if negative, it presents an opportunity to initiate a conversation on pre-exposure prophylaxis, which is PrEP. Once everyone is linked to care, there's the opportunity to work with patient navigators, community health workers, and then to help ensure that we move into step 3, which is engaged or retained in care. And once an individual is retained in care, they are prescribed antiretroviral therapy, and that is helping them to understand that consistency with their medication treatment also is a form of prevention or task as treatment as prevention, which then leads us to the ultimate goal of achieving viral suppression. With this, knowing that once you are virally suppressed, you are considered undetectable, which equals untransmittable. U equals U. Next screen, please. Our services include didactic presentations, such as the one we're doing today, workshops, preceptorships, where you have the opportunity to work with a clinical professional to understand how hands-on care can be applied, clinical consultations, such as reaching out to Dr. Nichols and having a conversation about a patient in particular, issues that you may be experiencing or want clarification on, and capacity building assistance. Next screen. So to understand our role in reducing oral health inequities in persons with HIV, our goal is to make the dental health care worker and the referral network, including case management, more comfortable in managing or treating the HIV patient by increasing their knowledge of how HIV affects the oral cavity and any provisions of care issues. And finally, by decreasing any contagion fears that they may have. Next screen. So as you can see, these are some topic areas that we've been able to present in the previous 4 years. With that, we were able to provide these trainings to approximately 240 healthcare professionals. So we don't limit it to just dental professionals. We open it up to everyone, because as mentioned in previous presentations, that you got to get past the mouth to get into the system. So if you're not understanding what's going on in the mouth, how can you actually help the patient? So with this in mind, I'm going to ask Dr. Nichols to chime in at this point and talk about our oral health and HIV symposium.
So we give something called an oral health and HIV symposium, and it's a 6-hour event. We do 3 hours in the morning and 3 hours in the afternoon. And we start at the basics, and I usually have a medical provider working with me, and we talk about, the very basics of HIV, what the virus is, how it's transmitted, how you treat it, how it affects the whole body. And then I talk about special considerations that you need to take into account when you're working on an HIV patient and the oral cavity. There are certain things that you need to do before, and there's certain information you need to have. And I just want to make people more comfortable treating the HIV patient. And then we have the physician or the medical person come back in and talk about HIV testing, and then talk about post-exposure prophylaxis and pre-exposure prophylaxis. And then I spend the rest of the time talking about all the different oral lesions that we see in HIV patients. And I have it divided into 4 sections called white lesions, red or purple lesions, ulcerative lesions, and then papillary or nodular lesions. And it gives you an overall perspective of all the different lesions we see in HIV, whether it's HIV related or not. Because as our patients are getting healthier on the medications, they're presenting with more non-HIV related lesions. So I want the people to understand just everything that we're seeing in the HIV patient's mouth, whether it's related to HIV or whether it's not related to HIV. Because there can be some confusion if you just focus on one type of lesion or not. And then throughout the lecture, I will present some case histories or talk about some patient experiences that makes you feel more like you're more involved with the situation or have a deeper understanding. And we've gotten very good results with this. And we're now doing it virtually. I used to give it in person, and we'd go to Baton Rouge or New Orleans and give it. But now, because of the COVID epidemic or pandemic, we've been doing it virtually. Okay, Dana,
Thank you, Dr. Nichols.
you're welcome.
So with that in mind, I just want everyone to understand that, again, we are not limited to helping just physicians or nurses. We're open to all healthcare professionals, and these topics are available for anyone to request if you're interested, or if not, then there's other topics that we can work with you to provide. Next screen, please. And as Dr. Nichols said, last year, we were hoping to provide this particular presentation in conjunction with the summit, the Oral Health Summit in Shreveport, as it was being planned. But the pandemic put a cease to that. And so we're now working towards virtual presentation. And hopefully with, as we move along throughout this calendar year, we might be able to get back to providing it in person. So we're gonna keep our fingers crossed on that.
Dana, let me add one more thing.
Sure.
For dental healthcare workers, whether it's dental dentists, dental assistants, or dental hygienists, we can arrange to have 6 CE credit hours. That's really nice. And for nurses, I think we can give 5.3 credit hours with the presentation. So that's really another cool thing. And there's no cost to get these CEs because it's being sponsored through the AETC program.
Thank you for that, Dr. Nichols. We can go to the next screen. So with that in mind, I would like to share, there are some additional ways that healthcare professionals can get involved in what's going on throughout the state, and particularly in oral health. There is the Get Loud Louisiana program that's the state is working on to towards ending the HIV epidemic. There's also state efforts regarding learning more about the science of U equals U. And just so you are aware that anyone can educate about pre-exposure prophylaxis. So in our efforts to ensure that HIV is not, remains an epidemic, but become a chronic illness that we are managing, that let's educate everyone. And we welcome the opportunity to provide training or collaborating with you to reach more healthcare professionals as we work to increase awareness of the AETC and knowledge regarding HIV. Feel free to contact me as indicated on the slide, or Dr. Nichols. Dr. Nichols, you want to share your email address?
Yes, it's mnichols@avenue360.org. That's MNICHOLS @avenue360.org. Thank you.
Thank you all again for this opportunity.
And thank you so much.
Thank you, Dana and Dr. Nichols, for your presentation. Next, we'll go over into our next presentation. I'll just give a brief introduction. So next we have Monica Roberts. She is a Dental Hygiene Clinical Coordinator at the Louisiana Department of Health within the Office of Citizens with Developmental Disabilities Resource Center. So now I'll just kick it over to you, Monica.
Good afternoon, everybody, and welcome. I'm looking forward to sharing with you some of the challenges that are being faced by people with special healthcare needs in regards to dental services, and mentioning some of the current initiatives that we have going on in the state of Louisiana to improve access and some of the resources that may be helpful. The presentations that have been presented thus far in the general sessions were very enlightening, and I'm excited to know that Open has now basically developed a team, or launched a team, that's going to be addressing these needs as well. Next slide, please. Okay, next slide, please. I'd like for you all just to kind of take a moment and look over this definition of special health care needs. As we can see, this definition is pretty all-encompassing, and at any given time, either ourselves, a loved one, a colleague, or a friend could acquire a disability or become a member of this group. Approximately 25% of the US population has a disability. Next slide, please. In the area of special care dentistry, it's basically dentistry and adjusting oral health management to accommodate a person's special physical or mental disability or medical condition. These additional supports can range to being very minimal or something extensive. It could be as simple as adding time for a dental service, making adaptations for a toothbrush, or having to coordinate dental services for a person in a hospital operating room. Next slide, please. This slide just shows a few of the common developmental disabilities. And it's just like to point out that a developmental disability is one that manifests before a person reaches the age of 22, and it's likely to continue indefinitely. Developmental disabilities occur among all racial, ethnic, and socioeconomic groups, and about 1 in 6, or about 17% of children aged 3 through 17 have one or more developmental disabilities. With that being said, since this is a disability that's likely to continue indefinitely, these children grow up to become adults with developmental disabilities who function at variable levels. Some of them include ADHD, autism spectrum disorder, cerebral palsy, hearing and visual impairments, spina bifida, fetal alcohol syndrome. And in addition to the developmental disabilities, some other common disabilities are traumatic brain injuries, epilepsy, cystic fibrosis, and other psychiatric disorders. Next slide, please. Establishing a dental home and prevention of oral disease is essential. Active disease and infection can exacerbate a pre-existing medical condition, leading to severe complications and in some occasions death, especially for those people with disabilities and complex medical needs. Neglect of oral hygiene and advanced periodontal disease are the predominant health problems of people with disabilities. Preventive care can avert unnecessary pain and reduce the need for costly dental procedures. Many times the pain and or the inability for a person to articulate the pain or their needs can result in inappropriate behaviors that can cause trauma to self or to others. Next slide, please. Some of the barriers that impact access to care include finding a dentist that's willing as well as equipped to treat the person. And because of the disability, some individuals may require extra supports at a dental office or facility, and the dental providers who are unfamiliar with the needs of this population may be reluctant to see them. And a lot of times it's just a matter of being unfamiliar and the clinician feels a little bit intimidated. So with some training and supports, most individuals with disabilities can be seen in a general practice office. Next slide, please. Financial issues are a very common barrier. For many people with special health care needs, incomes are fixed and budgets are tight. There's just no disposable income available to pay for dental care. And Medicaid offers comprehensive benefits for children and adolescents, but those benefits pretty much diminish once they reach adulthood. Currently in the state, there are some variations of expanded dental care for adults, but again, it's pretty minimal and limited and don't always meet the needs of those with special needs. Next slide, please. In addition to the affordability and difficulty finding a dental care provider, some of the other barriers and challenges are aversions to dental care, lack of time on the part of the caregivers, meaning that a lot of times a person has additional needs that have to be addressed, and dental is not usually at the top of that list. A person may have the complex medical needs, which means that they need to be seen in a specialized setting, such as the operating room, or there needs to be coordination of the multiple healthcare members. And another big one is transportation. Unfortunately, we don't have a lot of available providers across the state of Louisiana. So on occasion, we have people traveling from as far as Shreveport to have to come into New Orleans to University Medical Center for services. And even just for local services, a person may not have a road reliable vehicle, just may not have the money to pay for gas to make the trip. And on occasion, individual needs to be transported via ambulance. So that involves additional coordination. Next slide, please. The keys to successful oral healthcare outcomes are to get to know the person. We need to holistically approach the oral healthcare needs of the person. We need to know them and to identify their needs, and we need to communicate and collaborate with all the members of the health and the dental teams, various social service supports, the caregivers, the families, the primary physician, any specialists that the person is seeing, in order for us to facilitate the integration of physical, behavioral, and dental health services. Next slide, please. Improving access to care. Some of the key areas that are needed to improve access to care are for us to be able to identify and share resources for providers, as well as to incorporate special needs training in dental and dental hygiene curriculum, and offer continuing education training for dentists and other dental healthcare professionals. And this means, it means that your front office staff, dental assistants, anybody that's in that office that a person is going to come in contact with. And we also need to increase reimbursement rates and to seek additional build funding sources. Next slide, please. I'm happy to say that with this, in the state of Louisiana, we currently have a State Advisory Committee Dental Task Force, which was recently established, and it's to address the disparities and barriers faced by adults 18 plus who require general anesthesia or IV sedation. This subgroup of the special needs population have severe aversions to anyone probing in their mouth, and it normally requires some additional supports, and they just aren't able to be seen in a routine standard office or facility. The members of this task force are representatives from families, provider agencies, Medicaid, OCDD, disability rights organizations, the MCOs, some of the managed care organizations, the LSU School of Dentistry, the United Cerebral Palsy programs, and various policy advocates. And you can find the full access of this report that's been submitted on the Summit resource page. Next slide, please. Some of the specific goals of the Dental Task Force are to advocate for adult dental coverage for people with intellectual and developmental disabilities that parallels the EPSDT program. For those who aren't familiar with EPSDT, that's basically the Medicaid dental component that supports those under the age of 21, that provides diagnostic, preventive, and basically full mouth restorative coverage. And one of the other goals is to incorporate special needs training into the dental and dental hygiene curriculums across the state, and to also provide continuing education, to expand provider capacity in dental offices, the federally qualified health centers and various outpatient surgical centers, as well as the hospitals. And we also want to establish and expand private and public funding sources. Next slide, please. On a national level, there is the initiative by the Commission on Dental Accreditation, which is CODA, that has introduced a standard that requires dental schools to ensure that curricular efforts are focused on educating dental and dental hygiene students on how to assess and treat people with special healthcare needs, and to also increase experience for general dentists through residency trainings and continuing education courses. Next slide, please. The impacts of COVID-19. Just as COVID has impacted so many different populations across the board, it's had its effects on those with special health care needs. Two positives that have come out of it is teledentistry, which Dr. Collins focused on a little earlier in the general session, in that we do have a bit more flexibility, which has allowed improved access in ways of triaging. And then there are other benefits that are mentioned. And there's also been increased awareness of oral health disparities. This has been a time that we've been able to utilize and educate and inform people to show them what the oral health disparities are and how we can collaborate and to advance treatment for this population. Some of the negatives have been the reductions in appointment availability. There's been extended wait times and limited access for routine appointments, and especially for appointments within the hospital setting. There's been restrictions on support staff being able to accompany an individual to an appointment. A lot of times there's some supports that the individual may need, and with limitations on the number of persons able to attend an appointment, sometimes that has interfered with treatment or compromised the care. There's been more stringent infection control guidelines, and although they're critical for added safety measures, they have created some barriers to communication, informed consent, and contributed in some cases to increased anxiety and fear. Unfortunately, having to wear the face mask continuously, you don't get that face-to-face, the ability to smile or to try to reassure or console and communicate with the person, at least with their initial greeting. Normally a person could present to an office or a facility and the person at the front desk didn't have to wear a face mask. So they could be, I say, greeted with a smile and just building the rapport with the individual. Now it's a bit difficult with having to have the face mask and the coverings. Next slide, please. Here we have a few of the specialized organizations that offer training materials and just various information for professionals as well as the general population. That's the Special Care Advocates in Dentistry, as well as the Special Care Dentistry Association, the American Academy of Developmental Medicine, and also through the University of Washington. They offer a real extensive training program for dental professionals, as well as some great training materials and resources for families and patients and provider agencies. Next slide, please. Within the state, we have the Louisiana Department of Health has a few disability resources, and one, of course, is the Office for Citizens with Developmental Disabilities that offers a variety of resources and trainings and literatures on the website. There's the Louisiana Department of Health Bureau of Family Health, as well as the Governor's Office of Disability Affairs, which one of our other panelists will be speaking on for that agency. Next slide, please. OCDD, or the Office for Citizens with Developmental Disabilities, is responsible for providing supports and services to those with developmental disabilities in the state of Louisiana. And the Resource Center is one component. The Resource Center's goals include building capacity and to improve health outcomes for recipients with developmental disabilities. And for more specific information on eligibility and services, you can contact your Human Service District office in your region, which this graphic illustrates, or you can visit the LDH OCDD website. Next slide, please. This is my contact information. The best way to reach me is by email. And I do thank you for your interest in learning about this special population. And I'm looking forward to our panel discussion. I do see we have a few things in the chat. Terrence, do we have time to address these now, or should I wait till the end?
We can wait to address them towards the end if you don't mind.
Sure. Okay. Thank you all.
Thank you for that presentation, Monica. Very informative. We'll next go into our next panelist. And I'll do a quick introduction. I'm sorry. Cheri Crain is the Compliance and Planning Program Manager at the Governor's Office of Elderly Affairs. So I'll kick it over to Cheri. I'll go to the next slide.
Thank you, Terrence. You can go ahead and go to the next slide.
Okay.
Good afternoon, everybody. I'm Cheri, and I am the program manager, as Terrence introduced me. The Governor's Office of Elderly Affairs is known as GOEA, and we are the state unit on aging for Louisiana. We oversee core programs and a wide range of home and community-based services for aging citizens. Next slide, please. The services being provided are the foundation for our agency network. The network is responsible for coordinating the services and activities for older adults who are more vulnerable and are in need. Next slide, please. According to the 2019 census estimates, Louisiana's elderly population has crossed the 1 million person threshold. For the first time in history, there are more seniors living and working in Louisiana than there are persons under the age of 15. Our mission is to serve as the focal point for the developmental, implementation, and administration of public policy for the state of Louisiana to address the needs of the state's elderly citizens. It is our goal to serve as an effective and visible advocate for the elderly population in Louisiana, enhancing seniors in need receive appropriate services from providers in the aging network. Next slide, please. GOEA manages the Older Americans Act funding as the state unit on aging. The funds are to provide services to those individuals who are at least 60 years of age and are assessed to be the most needy. Next slide, please. OAA has provided funding for services that assist and support older citizens to maintain their independence and remain in their homes for more than 50 years. These services are provided primarily by the Louisiana Aging Network. Next slide, please. Service providers can be located on our website at www.goea.louisiana.gov, along with all of their contact information. Next slide. In our annual report for 2020, some of the program statistics included by the number of units are recreation and health, where we have provided 538,000 units of participation. We have provided over 472,000 transportation visits, and we have provided over 31,000 in personal care attending. Next slide, please. Satellite senior citizens, meal sites, or a full senior center serve congregate meals to seniors all over the state. There are currently 139 senior centers, which can also be viewed on our website. And I've listed the website again. Next slide. The Aging and Disability Resource Centers provide a single point for all long-term support services. The Senior RX program connects qualified low-income individuals with discount prescription drugs direct from the pharmaceutical manufacturer. Trained counselors are also available to provide Medicare Part D prescription drug coverage plan comparisons and enrollment assistance. There is a lot of information on a couple of these slides. This one in particular was really interesting to me because for every dollar that the state has invested, we have a return where we have saved $11.09 through our Senior RX program. So that is really a good benefit that we have come up with that program. Next slide. If you need additional information about our Senior RX program, you can go to www.louisianaanswers.com, and they have a FAQ there as well as some contact information for anything that you would need. Next slide. Do you know what an ombudsman is? An ombudsman is a worker who investigates and resolves complaints made by or on behalf of elderly residents of long-term care facilities. Long-term care facilities are nursing homes, assisted living facilities, and personal care homes that serve individuals aged 60 years and older who are elderly and disabled. Next slide, please. Some of the common complaints or issues received by our ombudsman is mostly my mom isn't being taken care of properly. My mom hasn't been changed or moved in several hours. They might not like to eat at 11. Can my lunch be served at a different time? And there's a few others that are listed as most common. Next slide, please. Who would contact an ombudsman? Anybody. Ombudsman services are confidential and they're free of charge. The statewide toll number is listed. It's 1-866-632-0922. Next slide, please. GOEA has an elderly protective services program that is mandated by Louisiana law, which requires the reporting of abuse, neglect, and exploitation of vulnerable adults. All reports should be reported as soon as possible, and failure not to report is a crime. Next slide. EPS staff intervenes when and where appropriate and prepares a plan of resolution, monitoring at each step until the situation is stabilized. In our 2020 annual report, the top two categories of abuse reports were self-neglect and caregiver neglect. Next slide, please. The Medicare Improvements for Patient and Providers Act program, better known as MIPA, is an outreach and educational program to assist Medicare eligible individuals make sound decisions on their Medicaid Part D plans. The program educates and assists individuals with their enrollment. Next slide. The total number of enrollments in Medicare Part D for the year 2020 was 1,860. We assisted individuals in Part D counseling with over 3,330 individuals, and we assisted the low income subsidy and NSP enrollment for 4,331 people. Next slide. If you know of an elderly individual that needs assistance with their Medicare enrollment, they can call the toll-free number 1-877-340-9100 and receive assistance for free. So with all of this background information I kind of gave on our programs that we have here at GOEA, there's a lot of opportunities to get information out to our councils on aging so that they can share with the seniors when they come to the councils to get their meals, or when meals are being delivered. We have passed out handouts at that time as well. So really to push the oral health care on the elderly, to look at how many people in the 2019 estimates that we now have more seniors than we do children 15 years of age. That is astronomical amount of people that are out there that need health care with oral care as well. So to bring it home, next slide, please. This is my contact information. If you have any questions, or if you need to get in touch with one of the councils on aging, you're more than welcome to contact me. As Monica said, email is always the best and easiest way to get in contact with me. And I usually try my hardest to respond within 24 hours. So please feel free to contact me. And that's it. Thank you.
Thank you, Cheri, for your presentation. I love the graph, like the slide effects. They were pretty cool. So.
Thank you.
No problem. Okay. So next we'll go into our Q&A session. So first we want to just thank all of our presenters for presenting all this great information. So now we will take some questions. I will facilitate this Q&A session. So if you have any questions, please type in the Q&A box. Questions should be addressed to the presenter that you would like to address the question to. I have been looking at the chat. Karen, I think you asked a question about, can a copy of the presentations be provided? I'm sure that once the presentation, the summit is over, I'm pretty sure we'll disseminate the slides somewhere, either on our public-facing website, or the coalition will probably send them out to all of the attendees. We'll definitely get back with you and tell you the way that we're going to send those. Monica, I know you talked about some points that you wanted to address that you saw earlier in your presentation. Would you still like to address those?
Yes, I just had one comment as well regarding the Dental Task Force and its advocacy efforts. For those who would like to become more informed or to join us in those efforts, we do have a Gmail address that you can inquire to, or if you know anyone who has experienced difficulty with obtaining dental services, we'd like them to share their personal stories. We are trying to compile that information as well. And
give me continue. I'm sorry.
Oh no, I think if Kathy Dwyer is still on the line, if she could put that email address in the chat, and otherwise you can reach out to me if you're interested. Oh, she just posted it. But like I say, if you have any interest or any particular questions regarding the dental task force, please feel free to reach out to my email address or the address that Kathy just posted.
Okay, let's see if we have any more questions. I don't see any additional questions in the Q&A box. I'm just continuing to check the chat to see if I see anything else. Okay, so there isn't any further questions or any comments that any of the panelists would like to make. If you guys have any other comments that you might want to make, if not, we'll move on over into, let's see. Celeste Terry said, do you want stories written or video? Celeste, do you know who you are making that out? I think that's to
maybe to me, I'm thinking.
Yeah, I'm thinking.
We can have them written for sure. I'll have to inquire on the video to see what the capability is in order to share those, and I'll let you know. Thank you, Celeste.
Okay. Oh yeah, and Celeste did, as soon as you started responding, Monica, she said it was directed towards you. So that's great that you caught that. Okay, so that seems to be all of the questions that we have thus far. So I'll just go over into the next. Let's see. I'll go over to our evaluation. So you should. We would like for everyone to complete the summit evaluation that goes along with the panelist discussions that we had today. You can find that link to the evaluation in the chat. Taylor Bush just put it in there. We ask you that you complete this survey, as your responses will help guide us in planning the next summit, the 2022 Oral Health Summit. Of course, we value all of your thoughts, and we look forward to reviewing all of your suggestions and your feedback. Again, it'll help us out with our summit next year. Get to the next slide. Dana, thank everyone for joining our session. She said, feel free to reach out if you are interested in working with us or in need of training. Okay, so I'll go ahead and go over to Summit resources. So we ask that you take some time to review the Summit webpage. There are many resources that are shared there. The link is provided as well in the chat. And lastly, all presentations have been recorded and will be available on the page in the near future. So again, Kathy, I think you asked about that initially. They will be made available in the near future. If you have any final questions for the Oral Health Coalition or have interest in joining the coalition, the contact information is above and the names of the executive officers. Again, Louisiana Oral Health Coalition, the email address is la.oralhealthcoalition@la.gov, or you can visit the public-facing webpage that we have on Wellhead Louisiana's website at www.wellheadlouisiana.com/Oral Health Coalition. And our executive officers are Sue Catchings, who is the chair, Dr. Billy Hall, which is the vice chair, and Annette, who's the secretary. Okay, so on behalf of the Louisiana Oral Health Coalition and Wellhead Louisiana, we would like to thank you for joining us today. This concludes our 2021 Oral Health Summit. We hope that this is a day that you remember. Let's put our seatbelts on and brace for the ride. The road ahead is full of challenges, but just as many wins. So thank you for investing in our plan to achieve better oral health access and equality for every Louisiana. We'll see you in 2022. Thank you, guys.